Kidney cancer causes. Kidney cancer causes is one of the factors that has been difficult to predict, but studies have shown that smoking and weight-related causes over a prolonged period of time have been known to be a sure factor. Cancer of the kidney, as its name suggests, affects the kidney through the spread into the blood and its surrounding areas during the later stages of progression. It is the only cancer that is associated with more men than women. Notably, it is known to affect elderly men of 50 years and above. High blood pressure has also been associated with this type of cancer. Functions of the kidney. The body is known to have two kidneys on both sides that are strategically placed. They are the body's urine filter. Urine is made here before being transferred to the bladder, making it one of the body's important organs. Smoking is the kidney's #1 enemy. Prolonged smoking is known to have, amongst other, higher risk levels compared to any other kidney cancer causes. The number of those diagnosed with this form of cancer in the UK is relatively high. It is considered the 9th form of cancer in women in the UK and overall 6th amongst men. Kidney cancer causes continue to baffle researchers. Dialysis of the kidney has over the years been attributed to a cause of the cancer. Interestingly, this is not considered a direct cause, but with the increase of the number of sessions, the kidneys are known to produce more cysts, which are linked to kidney disease. Another important factor that has been difficult to explain is that some people inherit this. This can be a hereditary disease. Explaining might be a little difficult, but when you consider the younger generation who are suffering from the disease and have not been linked to smoking and dialysis, then that would be the answer. Symptoms of kidney disease. Just like with any other disease, there are symptoms associated with this form of cancer, but a better way to avoid self-diagnosis is to see a doctor and go for the required routine tests. The tests will enable the doctor to ascertain whether it is cancer, or to what stages of the disease it has progressed to. Kidney cancer causes have been linked over the years to several myths or uses of drugs and painkillers like aspirin and or paracetamol users in the UK. Known symptoms for kidney cancer include sudden and unexplained frequent urination with traces of blood, hematuria, short of breath more often than not when climbing stairs, and incidences of tiredness, poor eating, and incidences of high temperature sweats. Dramatic weight loss should not be taken lightly. That in itself might be an underlying factor of other things. Lower back pain, continuous unexplained pain below the ribs should be given first attention. The above is not a complete list of symptoms, as some present themselves in ways that even the patient cannot tell. It is only the doctor and medical personnel that can tell through scans, ultrasound, and all approved testing if one is suffering from kidney cancer. Other cancer risks. Kidney cancer has been linked to exposure to asbestos. Those exposed to harsh factory chemicals at their workplace have been found to be prone to suffer from kidney cancer. Some of these chemicals and their effects are not friendly and leave harsh residues to the lungs, thereby causing the cells to mutate. Just like with all different types of cancer, when diagnosed early enough, it is possible to contain it, if possible completely treat it. Cancer must be tested first, and proper scans must be done before any treatment procedure is began. Some of the kidney cancer causes or risk factors have been pegged down to age. As a person ages, so do their kidney. Overstretching the lungs is not good for the body's growth and healing. Kidney cancer can be found in two categories, namely renal and pelvis. They both have different symptoms, and patients should not at any given type self-diagnose before seeing their doctor. Cancer is easily cured on patients whose diagnosis has been earlier. It is important for people to go for regular checkups in order to avoid last-minute diagnosis. Kidney cancer has over the years been linked to obesity and other minor kinds of diseases. Diagnosis of this type of cancer is usually through different ways, namely a microscopic exam is usually done to ascertain the degree and level of the cells. Damage X-ray of the kidneys is usually done by the order of the doctor or practitioner. Scanning is done before ascertaining if the disease is kidney cancer. It is now easier than ever before to detect symptoms of cancer in their earlier stage. This is important as it is the only way to start treatment early. A different type of cancer, kidney cancer, is a subject that has been discussed over and over. Nobody has been able to come out clearly with set out causes of kidney cancer. The above listed are some of the causes that research and medical teams have found as some of the most effective causes of cancer of the kidney. There is one type of cause that researchers believe is inherited called Vealinger. This is mostly inherited and is the form of cancer that is prominent amongst the younger generation and is known to be slightly different from other forms of kidney cancer. Finally, when looking for kidney cancer causes, it is important to note that with increase in technology, scientists will still be able to come with newer versions of causes as lifestyles change and people spend less time outdoors. Exercise is good for human beings. Most people now don't move from their desks and end up gaining unnecessary weight through sitting and eating the wrong foods. Unless people are able to change their lifestyle and eating habits, these lifestyle diseases will catch up with them and the number of people losing their life because of cancer will definitely increase.